Our celebration of Champions of Healing and bringing together our community is really a recognition of people as people, and that's the essence of Maimonides.
Maimonides Medical Center looked at Brooklyn and saw that in a city of 3 million people, there were almost no cancer services.
I believe Maimonides was the first institutions in the United States that purchased the robot and started using it for cardiothoracic procedures.
I would put our center up against any center in the city, the state, the country, or the world.
We are the largest NICU in Brooklyn. We deliver the most babies in New York State.
We were the hospital where the first heart transplant was performed, and we were the hospital where a lot of other firsts were performed.
We're the only children's hospital in Brooklyn. The department and my division, we focus a lot on family-centered care.
The message, no reason to go anywhere else.
I came to Maimonides because I think that it's a very important hospital. I always felt that the hospitals in Manhattan, if a patient didn't like their hospital, they could walk to the next one, even if they were in the middle of a heart attack. Here in Brooklyn, Maimonides is the key hospital to the health of this borough.
So we have a program which is a community outreach program. It's a program called Women's Heart to Heart. We go out to the community. We provide screenings including carotid ultrasounds, echocardiograms.
Maimonides Medical Center will actually be the lead center for this national aortic device trial.
So our LVAD program, we started in 2012. It's an implantable pump. We work together with our cardiac surgeons in the program.
What's unique about cardiac services here at Maimonides Hospital is the team approach that we take, the way that cardiology and cardiac surgery and vascular surgery work together for the good of the patient. That has resulted in overall great results for both cardiac surgery and cardiology.
When it comes to cardiac interventions, year after year, we are better than most of the state, and most of the years we are the best of the state. When it comes to heart failure and heart attacks, we are consistently one of the top 1% hospitals in the United States. And when it comes to heart attack mortality, we are always top 10 in the United States, and several times we were number 1 in the United States.
Everything we do comes back to our patients. The highlight has to start with the patients and end with the patients.
You know that this is his job, but aside of being his job, he's human and he shows you that side. And he's compassionate and he's caring.
So the goal in building Brooklyn's first, best, and only breast cancer team was to recruit for values first and then ability. And so we looked at emotional IQ, we looked at empathy. We can't teach empathy. A person has empathy or not.
Thank you. Thank you for starting this program here. Thank you for giving women like me a chance to fight.
And we have built a huge network with all sorts of social service providers to deliver and start to organize a better form of
learning, leadership, planning, teamwork. Those are all vital to a hospital like Maimonides. But there is another quality that is required, and that's stewardship. Stewardship is the vision to see the fundamental importance of providing the highest level of care and providing it to the residents of Brooklyn.
The most important thing that really drives us is the patient care and being able to, we deal with children when they're at their most vulnerable and when they're at their sickest, and we like to be there for the kids and their families in that time of need, and that's what really drives us to do what we do. I think what's really special about Maimonides is we have expert care, the same level of expertise you would find in all the other major children's hospitals around the country, but we're in an environment that's smaller, that allows us to spend more time with patients, spend more time with their families, and give a lot more personalized care.
Family is key to being part of family-centered care. The team consists of the parents at the center. A lot of the nurses are probably 30 years and more. And most NICU nurses, once they come into the field, they usually stay here. End of a good day is basically having a baby who's been here for a couple of months go home, no respiratory support, feeding their feeds completely and looking perfectly normal. It's a great accomplishment. I mean, that's what we strive for. That's what you work here for.
The emergency department of Maimonides is one of only maybe a couple in the 5 boroughs that are able to provide the level of service and the scope of service that we're able to provide. We have an incredible cardiac team who we work very closely with. We have an incredible stroke team who we work very closely with. We're one of only a handful of adult and pediatric trauma centers in the whole city. We are the only pediatric trauma center for the borough of Brooklyn.
The reason we developed the Bone and Joint Center was to enhance the patient experience. Prior to what we have now, patients really had to go to several different places to get all their care. For instance, they had to go see a doctor in the doctor's office. They had to go to an MRI place to get an MRI done, go see a therapist at another location. And then if they needed other services, such as an EMG or ultrasound, they had to go to yet another place. And then if they had to have a surgery, they had to go to another facility to get their surgery. So we developed a Bone and Joint Center. And the concept was to put all those services in one place. Maimonides is my first job. I came here right out of my training. I was born in Brooklyn. I was born at Maimonides, and it's always been my hospital growing up.
You don't have to go anywhere else for your cardiac care because the best outcomes are right here at Maimonides.
Maimonides cares for more patients than anyone else does and does it with an incredibly high level of care and an incredibly high level of commitment to their communities.
We are the hidden gem of Brooklyn. We definitely need to expand more, and I think we have more work to do here.
We have phenomenal clinical excellence that we deliver for patients every day. And that is we, that is you, that is all of us together, committed to and creating excellence that is competitive with Manhattan and the best in Brooklyn.